Hello, welcome. Today I'm speaking with Dr. Samantha Pfeifer from Weill Cornell, who is answering all of the questions that you may be too embarrassed or anxious to ask. So, welcome.
Thank you. I love doing this. The questions keep coming in. They're absolutely fantastic. It really is fun and engaging, and I really enjoy it. Yeah, I really do. It's really fun.
Well,
Plus,
thank
I get to see you, and it's always fun to see you.
you. You can get pregnant from oral sex, true or false?
Um, Typically false. It's sperm has to get into the vagina somehow, and it's hard from oral sex to have that happen.
Can oral sex on a woman prior to intercourse prevent pregnancy due to saliva affecting the sperm?
No. That is not a good way to prevent people getting pregnant. Absolutely not. No.
Should you take a break from oral activities if you're trying to get pregnant? Yes or no? True or false?
No. Think again, going back to the whole sex thing, if people are still interested in having an intimate relationship with their partner while they're trying to get pregnant, I view that as a positive thing.
Mm-hmm.
Because it's so stressful, it can often, it can often break people up, and it can, so anything, if there's any intimacy as a sign of affection that people are really banding together as they struggle through these journeys, I think that's a wonderful thing that, so I would say no.
Having sex 2 days before you ovulate or on the day of ovulation increases your chance of getting pregnant. True or false?
True. Having sex on the day of ovulation or the day before ovulation increases your chances. But compared to what? Compared to not having sex?
I guess, or it's different stages in your cycle.
Well, interestingly, there's pretty good data on this. And there's two things I think are high points to hit. Number one is that they have good data looking at the days leading up to ovulation. And if you have sex on the day before ovulation, the day of ovulation, you're more likely to get pregnant than if you have sex 2, 3, 4, or 5 days prior to ovulation. But the other interesting thing is that we now know that there may be sperm DNA fragmentation, and that may occur and be more likely to occur if the sperm sits in the male reproductive tract.
Mm-hmm.
So to improve sperm quality, which may improve or have a positive impact on reproductive outcome, we recommend that couples have intercourse 3 or 4 times prior to ovulation so that the sperm on the day of ovulation is fresh and hasn't been sitting there for a long time.
Mm-hmm.
So I answered the question, having intercourse the day before and the day of ovulation is the highest chance of conceiving. But having intercourse leading up to that time is probably beneficial as well.
Monitoring your cervical mucus can tell you when best to have sex. True or false?
True, but in a woman who is actually ovulating, because cervical mucus increases when estrogen levels are high. And that typically is in a woman who's ovulating, that's typically around the time of ovulation. But there are some women who will have relatively high levels of estrogen and don't ovulate. And so that could be misleading. Mm-hmm. So I think you have to couch that in someone who has regular menstrual cycles, picking the best time to have intercourse is the time when they're ovulating.
Does the length of time a man takes to ejaculate during sex make a difference to pregnancy? True or false? Yes or no?
False. No, it doesn't have any impact on the quality of the sperm. So it can it can be a longer process, but it shouldn't affect the sperm quality. As you're like, come hurry up, I got to go somewhere, but no, I think that it doesn't.
The size of a man's penis affect fertility?
Does the size of a woman's vagina affect fertility? would say no. So
In terms of deeper penetration, I guess, and helping with that.
no, not at all. I think that it has nothing to do with that. And, you know, what is normal? What is large? What is small? It's all relative.
Hmm.
So, but I would throw it right back at you and say, well, does a woman's vagina size make a difference? No. Everyone is different shapes and sizes, and if they fit together, it's good.
Is infertility or fertility issues, are they becoming increasingly common? True or false?
True, they are. But I think that there's a number of factors involved in that. I think that people are seeking fertility evaluation and treatment a lot sooner. I remember when I was first in practice, I would see people who had been trying for 3, 5, 7 years before seeking, you know, a consultation for fertility. And nowadays we're seeing people who have tried for maybe, you know, 3 months or 6 months and are worried about, you know, could there be something wrong? So I think that people are seeking care earlier. Um, and I think that's great because, you know, the sooner a couple comes in for evaluation or an individual comes in for evaluation, the sooner we can sort out if there's anything wrong. So I think it's a good idea. Um, the other thing is that people are waiting longer or later to get pregnant, and I think that adds to it as well. So there's a multitude of reasons, but it is, and I'm happy. I think it's great. It means that people are more aware that things can be done and that they're more educated.
Do you think it's lifestyle as well and toxins and the way that people are living today versus 50, 100 years ago?
I think there could be. I think that that is something that is an interesting theory, and I think there's a lot of research into that. And certainly the toxins have may play a role. I think it's hard to figure out exactly what that role is, but there certainly are in a lot of other environmental factors and toxins in the environment that I think may be playing a role. It's just hard to know exactly the interplay and how that is directly related to that, what mechanism. But I think that could certainly play a role as well. It's hard to know. I mean, you know, years ago, there were other things that were causing problems that we don't have as much these days, infections, and we can overcome tubal disease and all these other factors that are, so we have different factors than previously. And there are reports of, you know, sperm counts decreasing, and there's concern about ovarian reserve and how is that impacted by the environment and things like that. But, you know, when we look back to the early 1900s, your life expectancy was so much less. I mean, people were dying before some people nowadays are starting to have families.
Mm.
So I think you have to look at it in the context of, you know, what's going on now and what are all the factors involved. But it's sort of interesting to contemplate that.
And
But
also,
it's,
medicine
yeah,
has moved on so much.
yeah.
It means that there are options for people where they couldn't have existed 40 years ago.
Yeah, so many more options that didn't exist. I mean, IVF is only 40 years old, just over 40 years old. You know,
Mhm.
egg freezing has only been around for about 10, you know, 12 years maybe. Antibiotics happened after World War II. So when you think about it, there's so many advances in medicine that are helping people's lives and their quality of life in so many ways. So I think it's an interesting question to ponder, and I don't know the exact answer, but it's certainly a very complex situation.
Can fertility gadgets increase the chance of conception? True or false?
I love this question. I think this is great. Um, I would probably say true in the sense that fertility gadgets, if they encourage people to have sex, then that in and of itself would probably increase the probability of getting pregnant. Um, so in the sense that probably is it. Yes, from that mechanism.
Not from the
I don't
timing
know.
that the mechanism gives.
I mean, the timing for what?
Having sex.
You know, one of the things that we struggle with is people that have tried for a long time to get pregnant, And having sex has become a chore as opposed to a recreational activity. And numerous times we see people on medication, they're approaching the time of ovulation. I'll say, when was the last time you had sex? And they can't remember.
Mm.
Well, maybe last month sometime. So I think this whole process can decrease the number of times people have intercourse. And if gadgets increase the number of times and make it easier to happen at around the time of ovulation, then I think that's a good thing. And so that probably does help.
A woman becomes fertile when she starts her period, true or false?
Well, she does become fertile when she starts her period, but she can become fertile or may achieve a pregnancy prior to her first period, because for some, ovulation may happen before the first period actually happens. It's rare, but it could. So there have been, reports of people getting pregnant before they've had their first period, if they've ovulated. Yeah. But typically we say after the first period, then they're proof that they can be fertile.
A woman stops being fertile in her mid to late 40s, early mid to late 40s, true or false?
I think false. I wouldn't say stops being fertile. I say maybe less fertile. So it's semantics.
A lot less fertile?
I would say less fertile, but doesn't stop being fertile. So it's semantics. We know that egg reserves and egg quality decline, and they do so more after age 40 than they do between the ages of 35 and 40. We know from studies looking at incidence of pregnancy in populations that do not practice contraception, that achieving a pregnancy at age 45 is about a 1% chance.
Wow.
So it's a naturally without any assistance. So certainly after 40, the chance of achieving a pregnancy does decline, but it doesn't necessarily, you can't say women are not fertile at 40, after age 40. They're just less fertile.
Mm-hmm.
And individuals, there are some individuals who have stopped menstruating in their mid 30s. So after 40, they are. So I think it's a statement that in general, if you look at a population, the chance of getting pregnant is much less after 40 than it is, say, after age 30, between 30 and 40. But you can't say that unilaterally that fertility no longer exists after 40. For some people it might, for the vast majority, they're still fertile, but less fertile.
Can thyroid issues affect fertility?
I laugh at this because there's so much drama about thyroid with the TSH levels and people really looking to make sure the TSH is less than 2.5. And I've had some patients who've been very concerned about that and really worried if their TSH is, 2.6. So I would say for thyroid issues can affect fertility, but generally if the thyroid is really uncontrolled to the point that menstrual cycles are irregular. But thyroid levels that are, subclinical hypothyroidism, which is a very mild form of thyroid condition, doesn't really affect the ability to get pregnant and doesn't really have any impact on miscarriages. So it's really just overt under or overactive thyroid disease that may play a role.
Fertility issues run in the family, true or false?
They can. I say true, but for the vast majority of people, they really don't. I mean, some conditions that affect fertility can run in the family. So for example, endometriosis that can run in the family may affect an individual, may not. But there are other things like premature ovarian failure, or what's now known as primary ovarian insufficiency, may run in the family. Also, like Fragile X can be passed from generation to generation. That could run in the family, and that can lead to early menopause or primary ovarian insufficiency. So there are certain conditions that can. There may be male factors that also can run in the family that can affect, can affect male factors. So there are things that can run in families, but I think for the vast majority, probably it's relatively rare. It's not a common thing.
IVF offspring are likely to have fertility issues themselves, true or false?
I don't think we've determined that. To date, I mean, there have been many babies who are IVF babies who are having children, and I don't think that there's any data to support that that is happening on a routine basis. I think, 10 to 20% of the population is going to seek fertility care. Um, so it's going to affect individuals who are IVF children, but there's no data to my knowledge that says kids that were born from IVF are more likely to have fertility issues.
True or false? Everyone who comes into a fertility consultation has the same testing done.
Pretty much yes. I mean, everyone that comes in pretty much gets the same evaluation. We've got to check the woman. We've got to check, assuming it's a heterosexual couple, we've got to check the woman, we've got to check the male. We have to make sure that there's a uterus, that the uterus is functioning, that it's normal in appearance and can potentially hold a pregnancy, that there's fallopian tubes there, and that there's ovaries with eggs, and that there's sperm.
Mm-hmm.
So everyone gets the same basic evaluation. Now, if anything is abnormal, then you go off and dig deeper into, whatever abnormality you find to figure out why. But pretty much, it's really kind of like, crossing your T's and dotting your I's. You need all the data to make sure that you've looked at everything to come up with a reason. And the reason people do get a full evaluation is because you don't want to find something and stop and then treat that and then not look at everything else and find out 6 months later, oh, it would never have worked because we didn't check anything else. So, it's much better to get all of the information, all the evaluation done relatively quickly in the beginnings, then you know what you're dealing with.
Or checking the sperm at a later date when it could have been checked at the beginning.
Absolutely. And, I think that what many people do not understand is that 50% of all causes of infertility are related to male factor. And I think that culturally, in most societies, the fertility issue is perceived to be caused by the female. And when in fact, the men certainly can be contributing to that in a meaningful way.
Mm-hmm.
So I think I often see people who are here saying, well, I'm sure he's fine. I'm sure I'm the reason for the lack of conception. Like, no, it's a team sport. You need to check both people. And there could be something mild in each of them, but you do need to check and make sure.
Mm-hmm.
Even in people that have had children before. We've seen some men who are coming back with a potentially new partner, have had children in the distant or recent past. And you never know. I mean, you want to make sure the sperm hasn't changed. And, it's not unheard of to hear, gee, the man is azospermic and has no sperm. And the female partner's like, I never thought his kids from his first relationship were his. So,
Wow.
you never know. So I think you cannot assume for a man, if he has children, that his sperm is still good. It could have changed over time. And it may never been very good. So, and also there can be a low sperm count, but a low sperm count in a younger female who's more fertile may be okay. And in an older female, there may be more difficulty achieving a pregnancy. So it may not have changed dramatically, but you still have to make sure you check it.
Using PGTA for sex selection is controversial.
Yeah, it is. That's a yes, definitely. I think that there's exceptions to that. I think, on first hearing about it, you think, oh, why would you choose a boy over a girl or a girl over a boy? And is that really playing with nature? So I think there's one thought about that. And is that really an important aspect when really we're striving for a healthy pregnancy? On the flip side, there are cultures where having a male to perpetuate the family is really an important aspect. And for some couples, if they don't have a son, this is a major issue in their culture. So, I think that we call it family balancing, not sex selection.
Mhm.
I think that there's many factors that play into it, and you can't just look at it simply and say, oh, that's ridiculous. And there may be reasons to choose one sex over the other for medical reasons. For example, in diseases that are more common in boys than girls, it'd be safer to have a female than a male, just because the male is more likely to carry that gene, like hemophilia.
Mhm.
So, but I think that it's very controversial because there's many situations where it makes a lot of sense, so it is controversial.
Does IVF increase the chance of having a boy? True or false?
Um, it does. So it's true. However, as most of my answers are, however,
Not if you have
so what?
not if you have ICSI.
Well, no, it's not true.
Okay.
So if it's interesting because if you, and I actually, I did cheat and look this one up because I wasn't sure of the answer. My first response was, no. And so it turns out that if you look at natural fertility, like people who have not done IVF, okay, and you look at firstborn
Mhm.
children, okay, boys occur 5 to 6% of the time more frequently than girls. Okay.
Because male sperm swims faster?
No, we don't know why. We don't know why. There's a lot of theories out there, but no one has definitely proven that. However, and if you look at IVF, without doing genetic testing, so you don't know the sex of the embryo when it's put back. So this is looking at day 3 and 5 transfers, really before pre-implantation genetic testing was a routine thing. Boys happen more commonly. It's about 0.5% higher incidence for day 3 transfers and about 2% more common to have a boy than a girl in blastocyst transfers. So on the one hand, boys are more common, but on the other hand, they're less common than in couples who have not used any fertility treatments.
So yes, they're more common in IVF.
They are, but they're less common than the general population.
You could have PGTA and have a non-conclusive result. True or false?
True, true. So you've got to remember that PGTA, the way that that procedure is done is the blastocyst is isolated and the embryologist sticks a needle into one part of the blastocyst. So imagine the blastocyst as a soccer ball, appropriate analogy given the whatever it is that's happening in Qatar. So one of those little hexagons, they put a needle in the hexagon and they take out 3, 5, 6 cells of that whole embryo. And then they analyze the tissue. Okay. So first of all, there's not a representative sample. And second of all, you're dealing with such a small amount of DNA. The DNA is then amplified. So they have more of it to assess, and then it's assessed to see what the composition is. So there's many areas where there may be inconclusive results. The cells may not grow, the DNA may not replicate properly. There may be confusing answers where, they think that there may be a contaminant. So there may be a result that really is they're not sure of, doesn't blend with what they think, or the procedure failed and they were not able to amplify the DNA. We don't have an answer. So, or the answer says something really unusual, but the embryo looks so good that they feel that, that result doesn't agree with what we see with the embryo visually and by grading. So there can be inconclusive results. And then in that situation, the question is, do you rebiopsy to get a better answer or try and get a more definitive result?
Which
So
could be harmful for the embryo.
I mean, to do the biopsy again, you've got to thaw the embryo, biopsy another location, refreeze the embryo, and although we think that the biopsy and the freezing doesn't really carry a lot of risks to the embryo, I think that um, we can't say that definitively. There probably are some risks associated with thawing and freezing. They're minimal, but there may be some risks associated with that. So,
And no one has the data on whether that affects the children as well.
I mean, you got to realize that the pre-implantation genetic testing has only been around for maybe, in the way we do it today with the blastocyst, maybe, 10 to 15 years at most, but it really has not become widespread until recently. I'd say in the last, 5, 7 years or so. So it's relatively recent. Good
Thank
to
you
see
so
you.
much.
See
See
ya.
you soon. Bye. Bye.